16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 38 85 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
A stitch in time saves 9. It's better to cure any problem than it becomes worse. Hello viewers, a very good evening to one and all. Welcome to KIMSHEALTH Doctor Live. Myself, Rema Santosh. In today's episode, we have taken all about prostate cancer. To talk about this topic, we have an efficient doctor. It's my pleasure to welcome Dr. Abubaker Bandalla, consultant urologist, KIMSHEALTH Hospital, Azam. I am sure this episode will be very helpful to each and everyone. So let's move ahead. Hi doctor, welcome to our show. We would like to know more about you, sir.
Hi, my name is Dr. Abubaker Bandalla. I am a consultant urologist in KIMS Hospital. I am holding the German Board of Urology in 2002. Also having a PhD of urology from the Medical Council of Surgical Specialists.
Thank you, sir. Now let's move on to our queries. What is prostate cancer?
Yeah, actually prostate cancer is a very important disease in men, which contributes to many deaths among men, and it's considered to be the second most popular cancer after bronchogenic carcinoma in man. Most of men, they have this prostate cancer. They are actually in older age, after 60s, or sometimes we find it even after 50s. Prostate cancer disease, its disease can cause a lot of disability and can cause death among men, and we consider it a very, very important subject in our specialty. That's why accurate diagnosis and accurate treatment and early screening for prostate cancer, it's very important.
Okay, sir, thank you. What is the incidence of prostate cancer worldwide?
Prostate cancer has been connected to a lot of genetic factors and environmental factors, and the incidence among the population in the Mediterranean or in the Middle East, it's considered to be low when we compare it in the European community or in the Americans or in the Southeast Asia. The most important groups that can be affected with the prostate cancer, they are Black Americans. They are liable to get cancer more than the others, and it's considered when it's diagnosed, it will be in a late stage and it comes more aggressive than the others. That's mean other populations or other races also can affect with prostate cancer, but in low percentage than the others. Before they said that prostate cancer is a disease of old age, which its peak incidence after 60s and between 60 and 70 years of age. But in the last years we saw a lot of cases that have a prostate cancer who are below 50, and even with patients at the end of 40s, 45, 48, 49, we diagnose for them a prostate cancer. So prostate cancer cannot be said that it's a disease of old age. It can even happen in the middle age.
Okay, sir. What are the causes and risk factors for this prostate cancer?
Actually, like any other cancers, still the researches and literature cannot be identified what is the exact cause of the prostate cancer. But prostate cancer linked to some factors like genetic factors, which is the most important factor to have a prostate cancer. That's mean prostate cancer, it's running in families, and it can be inherited from genetic factors, and the genetic theory plays very, very important role to develop prostate cancer among men. Other factors connected to lifestyle of the patient. Theoretically, prostate cancer can be a disease of patients who are consuming a high fat diet and sedentary life, which their food contains a lot of fat. Some theories also connected the prostate cancer to smoking, but it's not proved till yet. Another factors plays a role. They connect some exposure to heavy metals like cadmium exposure, or the patient of the the people that are working in cadmium factories. They can have a risk more than the others to develop a prostate cancer. But the most important point in this issue, prostate cancer can be connected strongly to genetic factors, because prostate cancer can be, we see it a lot running in certain families.
Okay, sir. So how can we suspect that certain people may have prostate cancer?
Actually, prostate cancer in the early stages, it will give no any symptoms. The patient will have a prostate cancer, but he is completely well. He has no any symptoms. The patient lives a normal life. Only he may show that there is little changes in the urinary voiding habits, like dysuria or burning in the micturition in the urine or increase in the frequency, which are these symptoms can mimic even the benign prostatic enlargement in older population. Prostate cancer, nobody can suspect prostate cancer from the symptoms, but remains the core point that screening for the prostate cancer is very, very important, because when we detect prostate cancer in early stages, it can be a treatable disease, and we can even cure the patient from prostate cancer. So prostate cancer actually has no any significant symptoms in the early stage that the patient cannot come to you with any complaint, but only when it get advanced and the patient start complaining of the distant metastatic symptoms, then symptoms will occur. And in early stages, patient must screen himself for prostate cancer, and it's very easy to be screened through the regular visits to the urologist. Screening can be started after the age of 45 to take blood samples and to detect the prostatic antigen, which is appears in most of the cases with the prostate cancer. And we see in those cases who have a prostate cancer that is elevated more than the other population.
Thank you, sir. So, can you tell me more about that, how prostate cancer can be diagnosed?
As I mentioned before, the only method to detect early prostate cancer is the regular visits to the urologist, or even to the family doctor, to measure the level of the so-called PSA, which is prostate specific antigen. We can measure it in a simple test in the blood. This PSA, it's increased or increased in the blood only when there is cellular changes in the prostate, which is suspected for prostate cancer. Through this test, we can suspect that the patient is having suspicion that he will have prostate cancer. When this tumor marker or PSA level in the blood elevated, we can just go to do some radiological examinations, like transrectal ultrasound, which is ultrasonography of the prostate through the rectum, and we can see if there is suspected cases in the prostate, suspected areas in the prostate, which may have cancer cells inside. Even though nowadays there is development in the medical technology, and with special examinations like MRI examination of the prostate, we can even classify people who have the strong suspicion to have prostate cancer cells in their prostate. or the people that in spite of slight elevation of PSA, that they have no suspected area in the MRI examination. When through blood examination for PSA testing and combined with the ultrasound examination and MRI examination, there is strong suspicion that the patient will have prostate cancer. We have to go to a tissue diagnosis. Tissue diagnosis, actually, it can be done through transrectal prostatic multiple biopsy, through the ultrasonic examination, and in ultrasound examination we can see the whole prostate, and we can see even the suspected areas which can have prostate tumor cells, and we take a direct biopsy from these areas, and we send these biopsies to the histopathological examination, and after the histopathological examination we will be sure whether the patient have a prostate cancer, and even we can classify the degree of malignancy in the prostate cancer through special examination of this tissue in the prostate. And after the final diagnosis and the final staging of the patient, we will put the patient on staging, and we will put even the therapeutic regime for him, which is the best for the treatment of the prostate cancer.
So, what are the different signs and symptoms of prostate cancer?
As I say from the beginning, early prostate cancer in most of the patient cannot produce any symptoms. That the patient, he came to you completely healthy, he is not suffering from anything. Maybe he has lower urinary tract symptoms, which are mimicking even the enlargement of the prostate, the benign enlargement of the prostate. And so in the early stages, no any obvious significant symptoms. The prostate cancer only start to produce symptoms when it's advanced disease, and most of the patients, they are having symptoms from prostate cancer. They have it due to obstruction of the lower urinary tract and obstruction of the flow of the urine due to the enlargement of the prostate, and even symptoms can be attributed to the local invasion of the prostate in the pelvis. The patient will start feeling difficulty to pass urine, and the patient can even feel a chronic pelvic pain, which is bother him too much. And the most important symptoms of advanced prostatic disease, that the patient, when he left untreated or he is presented for the first time in a later stage, the bone has a very very strong liability. The prostate cancer has very strong liability to be metastatized in the bone. That the symptoms of bone metastatic spread of the bone, of the cancer cells to the bone. At that time, the patient will start feeling bone pain. He's feeling low back pain, pain in the pelvic bones, and he sometimes presents for the first time to the orthopedic doctor because he is suffering from strong pain, bone pain, cannot be relieved by ordinary medication. And when they make for him X-rays or radiological examination, they will find that they have prostate cancer spread from the primary prostate cancer to the bones. In late stages, some patients they are presented due to invasion of the prostatic cancer from the prostate to the ureter both side, and it will obstruct the flow of the ureter from the kidneys to the urinary bladder, and this obstruction will lead to dilatation of the kidney pelvis and dilatation of the ureter. And at that time, he will present with the symptoms of urinary obstruction or renal impairment, that the kidneys they start to be diseased from this obstruction, and at that time the creatinine and the blood urea it will be elevated, and the patient will present with symptoms related to the uremia. These are most of the symptoms of the prostate cancer, but these are usually related to the neoplastic spread of the disease. As I said before, usually in the early stages of prostate cancer, when the patient presented to the urology, he will just have mild, very mild symptoms. Can it be similar to the benign enlargement of the prostate?
Okay, fine. Doctor, is it a treatable disease?
Yeah, prostate cancer, usually when it's detected early and diagnosed early, and the treatment started early, it's a curable disease, and patient can be cured completely from prostate cancer. In this stage, we called it localized prostate cancer. That means the prostate cancer cells, it's only confined to the prostate, doesn't extend it beyond the capsule of the prostate. And in this stage, when we did the staging of the disease, we didn't find any lymph node involvement and no any local invasion of the bladder, and there is no any distant metastasis or no bone metastasis. We offer for the patient the so-called radical treatment. Radical treatment is considered as either a radical surgery or in patient whom not a candidate for surgery or doesn't willing to have a surgery because of its complication. We can offer for them the so-called radical radiotherapy combined with hormonal therapy. And these patients in the early stages, they are usually cured from prostate cancer, and even they can live for a long time before any complications or any life-threatening problems will happen to the patient. But in the late stages of the prostate cancer, we cannot say that it's a curable disease, but it can be controlled with a lot of therapeutic modalities, including long-term use of hormone therapy. and radiotherapy, either external beam radiation, or sometimes there is a lot of there is a advanced and method to treat prostate cancer with the so-called brachytherapy, or seed implantations of the radiotherapeutic seeds in the prostate. And in advanced, very advanced cases, even we can control the disease, and we can make the patient really free of the neoplastic-related symptoms for a long time with the use of chemotherapy. These are the therapeutic modalities of prostate cancer. As I mentioned, there is the so-called hormonal therapy. We can use it in some patients who are not localized prostate cancer. This hormone therapy, the goal of this type of treatment is to reduce the active form of testosterone in the blood for the patient by blocking the secretion of the testosterone hormone from the testis, which is, I mean, the testosterone hormone. It's gives very good nourishment to the prostate cancer cells, and the aim of this therapy is to block this formation of testosterone hormone, and we can through this type of hormonal therapy just make the prostate cancer activity very calm, and can not be flared up again.
Thank you, sir. What are the different signs and symptoms of such an advanced prostate cancer?
Yeah, as I said, the prostate cancer symptoms of advanced disease, it's related to the distant metastasis. If the disease separated outside the prostate, it will affect either the bladder pace and obstruct the urinary stream, and this will cause urinary obstruction, and the patient cannot void well. If the spread of the disease will involve the lymph nodes, and this will cause pelvic pain, and the patient cannot be normal. The most important symptoms related to the advanced disease, it's when the patient starts suffering from bone metastasis from the prostate cancer, when the patient start feeling reduction of weight, loss of appetite, and he's feeling unwell, and also he will start complaining of pain in the involved bones of the body, which are most commonly the bones of the pelvic bone, and even the upper part of the femur and the hip joint, and also the vertebral column. And also due to this metastasis, can the patient liable to have fractures in the bones, and also symptoms of spinal canal obstruction can be presented when the patient have advanced disease.
So what are the therapeutic options of prostate cancer in its early and advanced stages?
Yeah, as I said, in early stages, the option or the choice always and the priority goes for the radical treatment. That means eradication of the disease completely when it's localized when it's localized in the prostate only, and it can be either through surgical treatment or radical radiotherapy treatment. Surgical treatment, there is many options to offer surgeries for those patients, including the radical removal of the prostate and the lymph nodes in the pelvis, and can be done either with open surgical technique, or we can can be done with a laparoscopic technique, or in the last years they can be done with robotic laparoscopic surgeries. Radiotherapy can be done with either external PM radiation, with a special radiotherapeutic machines, which can irradiate the tumor cells in the prostate, combined also with the hormonal therapy, as I said. These therapeutic types in the early stage of the prostate can help the patient to get rid of the disease and can be cured. In the late stages of the prostate cancer, actually we have to treat only the symptoms and signs related to the metastasis of the disease. As I mentioned, hormonal therapy comes in as a first option. Also, we can use some chemotherapeutic agents, which are very good to make the disease better. And in some cases, we can use also some other new hormonal therapies to make the prostatic tissues, the prostate cancer tissues silent.
Fine, sir. Is there any screening tests for such a prostate cancer?
Yeah, it remains the only screening method is the estimation of the PSA testing. It's usually started as a screening agent worldwide, beginning from 50 years old or 55, but in patients who have a strong family history of prostate cancer, when their father, for example, died from prostate cancer, or they have brothers or prostate cancer running in the family, they have to do it in early age. And when even in some races like black-colored people, they have even to do it early. And screening of the prostate cancer always with estimation of the total PSA level, which when it's elevated above normal, then the patient must be followed by the urologist by all methods that I told it in the beginning, and if it's needed or it's necessary, must be underwent a prostatic biopsy to make sure whether the patient have prostate cancer or not. If he has prostate cancer and early stage, must be treated as early as possible before the metastatic disease it will arise, and then it was difficult to treat. Regular visits to the urologist, it's very important when by aging males, when they are above 50, they have to visit it regularly to estimate PSA testing regularly, and also sometimes it's digital rectal examination of the prostate can be palpated, but it's not helpful in the early stages. It's only when the advanced disease can be detected by digital rectal examination. And as a message to all men who are reaching 50 or above, they have to measure at least yearly prostate specific antigen, and must be followed or examined by the urologist, regular visits, to eliminate any element of prostate cancer suspicion.
Doctor, thank you very much for being with us this evening and answering all our queries. Thank you once again. We will be back again in yet another episode of KIMS Health Doctor Live. Until then, this is Rama Santosh signing off. Stay healthy, stay blessed. Bye-bye.
The 16th